Hey there, Dr. Benedetto here, sitting in my office, obviously. I wanted to shoot this quick video because it's a pretty cool story and one that I see every day. And so I just got done seeing patients here for the day in my physical location, but also in my virtual location. So I see people virtually. For those of you who don't know me, my name is Dr. Ray Benedetto, and I specialize in primarily helping people through functional medicine, primarily helping people pretty specialized in helping those with autoimmune thyroid conditions, so Hashimoto's, Graves' disease, those kinds of things. For a long time now, gosh, probably 12, 15 years now, it's been a specialty of mine. And this pretty cool case, as you can see by the title of this video, is we saved her thyroid and her health, probably a lot of other things as well. Maybe your life. That's the way I like to think about it when I'm helping patients. Is that there's some life changing care that we have going on here. So, I literally just my last virtual appointment of the day was a patient of mine. We're sitting here. It's the month of August, and I started seeing this patient in October, right? And so about we're talking 10 months ago, right? And she came to me and she had Graves' disease, so which is autoimmune hyperthyroidism, right? She came to me at the end of October, right? And so this all started in the beginning of October, so maybe like a month prior, like 3-4 weeks prior. And super severe, hyperthyroid symptoms, severe anxiety, can't sleep, brain's on fire. When you think hyperthyroidism, think like, oh, like your metabolism is just like fifth gear all the time, right? You can't turn it off. And so she was diagnosed with Graves' disease, and in the beginning of the month, so in the beginning of October, and then she met with me towards the end of October. She found me, and she, immediately they were just like, okay, we're going to give you the meds to slow this down. And I get it, right? So totally what needs to be done medically. So they're going to give you the medication to try and slow your thyroid down. If that doesn't work, we're going to cut it out. We're going to take it out. And she got to me maybe 3-4 weeks later, and she wasn't any better, and her numbers were off the charts, and she felt terrible, and she was like, I really don't want to take my thyroid out if I don't have to. I'd like to see if I can get this handled. Like, I saw that you help people with autoimmune thyroid conditions, Hashimoto's and Graves' disease. She was like, what can we do here? So I looked over her stuff, and I said, okay, well, we can do this, right? And I'll include, along with this video, somewhere around here, comment section or whatever, some of the info on what I do. That's not the purpose of this video. So she was like, I want to exhaust all possibilities. I was like, all right, here's what we can do, right? So we got started with a protocol, which again, it in its most simplistic form, when we have an autoimmune thyroid condition, right, the immune system's attacking the thyroid. So we got to do two things. We got to figure out why that's happening, like what's causing that to happen, right? Like root causes, triggers, whatever you want to call them. Like, what are the things that are causing the immune system to attack the person, broadly speaking, right? And that could be a bunch of different stuff. We might have to do testing and hormones and foods and you name it, right? All kinds of stuff. It could be. And then we got to put a plan in place. I use an AIP protocol that I've developed over the years. It stands for autoimmune protocol. We got to put an AIP protocol in place, some dietary work, some nutritional work, that's going to put the brakes on the autoimmunity, right? Decrease inflammation, calm down the immune system, fix people's gut, all that kind of stuff, right? So we got to do those things simultaneously. So we got right to work and put a plan in place for her, and we've been working that plan successfully. They kept bumping the surgery back, right? So things were improving. All right, we're going to bump surgery back. Things are improving, push it back. Things are improving, push it back. Things are improving, push it back. So here we are, 10 months later, and I literally just had an appointment with her, like minutes ago. So I was like, I got so excited. So I was like, I'm going to film this video. I'm going to throw this video out there because everyone needs to know about this, that this is doable. Again, with the right plan and with the right person working the plan with you. So 10 months later, right, just had had an appointment with her, and all of her thyroid numbers are completely normal. Like, she said, I love this because this happens when in my world with my patients. This happens a lot. Said like the endocrinologist is just like floored. Like they don't. The endocrinologist is like, I don't understand what's happening here. Like she didn't know what to make of it. That she was better. And if you had seen this patient of mine, like when we first met, and now, like I love it because like I hopped on an appointment with her today, and she's like a brand new person, like a brand new person. I mean, she was not doing well when we first met, and as we sit here today, she looks like amazing. Like you would never know what she looked like 10 months ago or how she felt 10 months ago. And she said that the endocrinologist was just like speechless, like floored, like didn't understand like what she was looking at, like that all of her numbers are looking good, she's feeling significantly better, all that kind of stuff. And because they're not used to seeing that, right? Like they're just used to like, okay, medicate the symptoms and then we'll just cut this thing out. Like let's medicate symptoms, let's get you a little bit stable, and then we're just going to do surgery, we're just going to cut this thing out, right? That's what they do, and that's all they're used to seeing, and they're never used to seeing anything else, right? So all of her thyroid numbers are in range. She's feeling phenomenal. She still has one of the Graves markers that is better, but still not all the way down. But the other one's down significantly. All of her hormone levels, her TSH, everything's in range. And she's feeling great, right? And I got excited. So I wanted to shoot this video because I love it. I mean, this stuff happens every day, like literally every day. With my patients in my world, like these things happen, but this one was really cool. Was a really cool case because really of how bad it was, and she just didn't want to have it cut out. She didn't have to. She wanted to exhaust all possibilities. So we got to work on a plan, and here we are. 10 months later, she is a brand new person. We saved her thyroid. For now, I'm not going to sit here and say that I have a magic wand, and that someday down the road something might not need to be done. But for now, for the short term, we've done a lot of work. We've got her figured out. We've got her fixed up. We've got her healed up, and she's doing awesome. So for now, we saved it for sure, and we saved her. Like she's doing awesome, so I got excited. I had to share on this video. Hopefully, this will be helpful for you. You need help with your autoimmune thyroid stuff? Let me know. Let's get to work. I have so many different ways I help people, even if it's just like, hey, here's an AIP protocol. Here's how to do it. Here's how to work it. Here's what foods to eat. Here's what foods not to eat. Here's what supplements to take. Everything from that to, okay, here's, the plan. Here's the 90-day plan to get started. Everything, like with this particular patient, like she's like, I want to hire you as like my concierge, like private doctor, and I'm just going to pay you and like help me and like, let's work on one-on-one to get this done. I think she would agree that was probably worth every penny, but she's doing awesome. I was super excited. Thanks for listening in. Thanks for hopefully soaking in some of my excitement. Again, my name is Dr. Ray Benedetto. Thanks for listening in today. Thanks for listening and watching me get all excited today. But I love this. This is what I do every day. So I got super excited today when I had that appointment with her. So I had to share it, maybe to help some other people out there who might need it. So cool. I'll see you on the next video.